Welcome to the new episode of Dr. Kayhan Show. I am Senem Ulusoy and I am the presenter of this program. Today we are going to talk about first one, rheumatoid arthritis, and the other African trypanosomiasis, the other words sleeping sickness, and four new things about medicine science. And then we started 2 programs before and we are continuing to talk about the magician healthy foods. Now, Dr. Kayhan, what is rheumatoid arthritis?
Rheumatoid arthritis is a chronic systemic inflammatory disease predominantly affecting the arterial joints and frequently a variety of other organs. The cause of rheumatoid arthritis is unknown and there is no specific diagnostic test. Rheumatoid arthritis occurs worldwide in all ethnic groups. The peak incidence of onset is between the 4th and 6th decades, but rheumatoid arthritis may begin at any time from childhood to later life. Females are 2 or 3 times more likely to be affected than males. Classification criteria for rheumatoid arthritis is divided in 7 programs. First one is morning stiffness. It is much more than 1 hour. And the second one is swelling, soft tissue or 3 or more joints. Third one is swelling, soft tissue or hand joints, proximal interphalangeal, metacarpophalangeal or wrist. The fourth one is symmetric swelling, soft tissue. Fifth one, subcutaneous nodules. Sixth, serum rheumatoid factor, positive. And the 7th one, erosions and or periarticular osteopenia in hand or wrist joint seen on radiograph. Despite intensive research over many decades, the etiology of rheumatoid arthritis remains unknown. 3 areas of interrelated research are currently most promising. One, host genetic factors. The second one, immune regulatory abnormalities and autoimmunity. And the third one, a triggering or persisting microbial infection. The pathologic hallmark of rheumatoid arthritis is synovial membrane proliferation and outgrowth, associated with erosion of articular cartilage and subchondral bone. The mode of onset of rheumatoid arthritis among different individuals is highly variable. In the majority, joint pain and or stiffness developments insidiously over several weeks to months. 1 or more small joints of the hands, wrists, shoulders, or knees, and or the metatarsobophalangeal joints are frequently the first symptomatic areas. Malaise and fatigue, occasionally with low-grade fever, may accompany musculoskeletal discomfort. As the disease progresses, joint swelling, tenderness, and a red or bluish discoloration became apparent. The pattern of joint involvement is typically polyarticular and symmetric, involving the proximal interphalangeal, metacarpophalangeal wrist, elbow, shoulder, knee, ankle, and metacarpophalangeal joints. Distal interphalangeal joints of the fingers are usually spared. Joint stiffness especially interphalangeal lasting more than 1 hour in the morning and after inactivity, is a prominent complaint in rheumatoid arthritis. So characteristic is the symptom that the duration of morning stiffness is often used as a quantitative guide to the activity of the inflammatory process in both clinical practice and research studies. The assessment of functional capacity is frequently Nelson in the rheumatoid arthritis patient, although various schemes have been proposed to simple classification that follows serves well in most situations. Class 1, no restriction of ability to perform normal activities. Class 2, moderate restriction but with an ability to perform most activities of daily living. Class 3, marked restriction with an inability to perform most activities of daily living and occupation. Class 4, incapacitation with confinement to bed or wheelchair. Rheumatoid arthritis can affect any diarthrotial joint. Those most commonly involved are the small joints of the hands, wrists, knees, and feet. With time, the disease may also affect the elbows, shoulders, sternoclavicular joints, hips, and ankles. The temporomandibular and cricoarytenoid joints are less frequently involved. Spinal involvement in rheumatoid arthritis is generally limited to the upper cervical articulations, in contrast to spondyloarthropathies. Rheumatoid arthritis does not cause sacroiliitis or clinically significant disease in the lumbar or thoracic spinal areas. Therapeutic management. The prolonged and uncertain course of rheumatoid arthritis call for special emphasis on the fact that most patients can continue their accustomed activities with restrictions tailored to individual cases. Excessive drug therapy, especially adrenocorticosteroids and immunosuppressive agents, can cause greater morbidity than the disease itself. Objectives of the management include relief of pain, reduction of inflammation, minimizing undesirable side effects. And the fourth one is preservation of muscle strength and joint function. The fifth one, the return as rapidly as possible to a normal lifestyle. The basic initial program that achieves these objectives for the great majority of patients consists of adequate rest, adequate anti-inflammatory therapy, physical measures to maintain joint function. We have learned that bed rest tends to decrease the general systemic inflammatory response. Most patients soon learn that their mid-afternoon fatigue is significantly reduced by a period of rest. At the same time, the full range of joint motion should be maintained. This can usually be accomplished by the patient through graded exercise programs. However, during acute attacks, passive range of motion exercise by a physical therapist or instructed layperson may be indicated. Physical overexertion increases synovitis and inflammation in the joint of the affected by rheumatoid arthritis, but this does not contradict the usefulness of appropriate exercise. Exercise as well as heat treatments such as showers, baths, warm pools, paraffin baths, or hot packs should be used to loosen the joints and relieve stiffness. Exercise following the heat treatment maintains the motion of affected joints and prevents muscle atrophy.
Thank you for your explanation. Now talk about African trypanosomiasis. The other word, sleeping sickness.
Sleeping sickness is a big problem for the part of Africa, and we know that it's invaded with vectors. This is a big problems if it's invaded cranial nerve system because we don't treat it after affecting the cranial nerve system. African trypanosomiasis, the other name is sleeping sickness, known widely as sleeping sickness. African trypanosomiasis is an acute and chronic disease caused by Trypanosoma brucei. The parasites are transmitted to the humans through the bite of the tsetse flies located in the regions of Africa between 15 degrees north and 15 degrees south latitude. In humans, there are two distinct forms of the disease: East African trypanosomiasis, caused by T. brucei rhodesiense, and West African trypanosoma, caused by Tsetse brucei gamliense. Although there is some clinical overlap, East African trypanosomiasis primarily causes an acute febrile illness with myocarditis and meningoencephalitis that is rapidly fatal if not treated, while West African trypanosomiasis is characterized as a chronic debilitating disease with mental deterioration and physical wasting. A comparison of Gambian and Rhodesian sleeping sickness, this is important because they are two different forms. Gambian, according to etiologic agents, Trypanosoma brucei gambians is the reason of Gambian West African sleeping sickness. The other one is Trypanosoma brucei rhodesiense. This is the reason of Rhodesian East African sleeping sickness reason. These vectors are different. For Gambian is Glossina palpalis or tachinoides. For Rhodesian, Glossina marcellanus. Distribution for Gambian, West and Central Africa. Rhodesian, East Africa. Reservoir for Gambian, human, domestic animals. For Rhodesian, wild animals. Course of infection, its course of infection is slow, months, years for Gambian West African. For Rhodesian, rapid, everything is occurred in 1 year. And according to the clinical features for physicians, for doctors, you can see a lot of lymphadenopathy for Gambian sleeping sickness if you compare with Rhodesian form. And you can see myocarditis in Rhodesian form, but you can't see myocarditis in Gambian form. Also, heart failure is added to the myocarditis symptoms. Neurologic symptoms are much more in Gambian West African form of sleeping sickness. And disseminated intravascular coagulopathy is much more in Rhodesian East African sleeping sickness form. And parasitemia is low in Gambian form and high in Rhodesian form. It's estimated that African trypanosomiasis infects more than 20,000 Africans annually, and that approximately 50 million people live at risk of acquiring trypanosomiasis because of the presence of the disease and its vector. Approximately 4 million square miles in Africa remains unpopulated because of the presence of T. brucei infection, which results in the loss of domestic and wild animals, including cattle, waterbird, and bushbuck and buffalo. TB gambians occurs primarily in the west and central regions of the sub-Saharan Africa. Although it primarily infects humans, there may be animal reservoirs such as pigs, dogs, and sheep. Gambian sleeping sickness is spread mainly by 3 species of tsetse fly. Distribution of these flies includes shades areas along rivers and streams where the condition of temperature, darkness, and moisture are optimal. TB rhodesians is primarily East Africa from Ethiopia and eastern Uganda south to Zambia and Botswana. Rhodesian sleeping sickness is spread by tsetse flies. These tsetse flies can survive in the open savanna, and Rhodesia sleeping sickness usually occurs among individuals visiting or traveling through an endemic area. Consequently, hunters, fishermen, and tourists are at risk, exposing themselves to vectors that usually feed on wild animals. Clinical features: there are two clinics. First one is Gambian and the second one is Rhodesian. Gambian sleeping sickness, within several days following the bite by an infected tsetse fly, a trypanosoma nodule or conchal develops, typically on the exposed parts of the body. Within a week, the lesion becomes a hard, painful nodule surrounded by erythema and swelling, which persists for 1 to 2 weeks. After the incubation period, clinical features develop after systematic, lymphatic, and circulatory invasion of the trypanosomes. Fever, headache, dizziness, and weakness occur in the majority of these patients. Febrile episodes may last 1 to 6 days, alternating with febrile periods. Lymphadenopathy with prominent supraclavicular and posterior cervical enlargement is seen in more than 80% of infected individuals. Known as Winterbottom sign, these enlarged lymph nodes are usually discrete, rubbery, and painless. Moderate splenomegaly may occur, and urticaria and erythematous ratios have also been observed. Electrocardiograms are often abnormal, but clinical signs of the heart disease are unusual. 6 months to several years after the first appearance of symptoms, the clinical features of these early hemodynamic stage progress to a late meningoencephalitic stage. Behavioral and personality changes are of the first signs of cranial nerve system involvement. Later, more florid physiological changes may occur with hallucinations and delusions. Reversion of sleep rhythm is characteristic with drowsiness during the day. Other nervous symptoms include tremor, most characteristically of the face and lips, and hyperesthesia. The cerebrospinal fluid shows an increase in cells and protein, much of which is immunoglobulin M. Trypanosomes may also be evident within the cerebrospinal fluid. The second one is Rhodesian sleeping sickness. This disease is more acute than Gambian sleeping sickness, and symptoms usually occur a few days after the victim has been bitten by the tsetse fly. Alternating periods of high fever, malaise, and headache followed by several days of well-being are often misinterpreted as an acute malaria infection. Lymphadenopathy is not prominent in this variety of the disease, and Winterbottom sign is usually absent. Tachycardia with arrhythmias and extrasystoles is common. Anemia, thrombocytopenia, and disseminated intravascular coagulation are usually evident within the first several weeks of infection. Liver enzyme values are often elevated, and electrocardiograms are abnormal, usually reflecting underlying myocarditis. Neurologic features are similar to those described for Gambian sleeping sickness, but they occur much earlier with more rapid deterioration. Without treatment, the disease may result in death within a matter of weeks to months. Diagnosis. Although a presumptive diagnosis of trypanosomiasis is based on clinical suspicion, history of travel to areas where this disease is endemic, and tsetse fly exposure. Confirmation of the diagnosis is based solely on the demonstration of trypanosomes. These organisms may be found in the blood, bone marrow, centrifuged cerebrospinal fluid, lymphadenopathy, aspirates and scraping from the conchers. Trypanosoma can be found in most patients provided that the cerebrospinal fluid is examined after collection. ELISA is so much helpful for diagnosis. Treatment. Suramin is the drug of choice for the early hemolymphatic stage before cranial nerve invasion has occurred. Suramin does not cross the blood-brain barrier in increased amounts. Pentamidine isothianate is an alternative drug for the treatment of early hemolymphatic African trypanosomiasis. The arsenical melarsoprol is the treatment of choice both Gambian and Rhodesian sleeping sickness once involvement of the cranial nerve system has occurred. Prognosis. Untreated African sleeping sickness is almost invariably fatal. Many patients with early Gambian sleeping sickness may remain relatively well for months to years without treatment, but once cranial nerve system involvement has occurred, that is inevitable unless treatment is given. That frequently results from pneumonia from heart failure. Control and prophylaxis. Measures to prevent and control African trypanosomiasis can be instituted at 3 different levels: surveillance and treatment, chemoprophylaxis, and vector control. Surveillance with treatment is necessary to reduce the human reservoir of infection, particularly in areas where epidemics have occurred in the past. Dentamidine has been successfully used as a chemoprophylactic also.
Thank you, Dr. Kayhan. Yeah, now you have news about medicine science. They are good news.
Yes, there's 4 new goods. The first one is too important for Africa. You know, there's an Ebola virus. It's invaded all part of Africa, and it's a big risk for all over the world. An experimental 2-dose vaccine regime against Ebola was safe and produced immune responses in children and adolescents. A researcher said here, the adenovirus 26 vectored glycoprotein vaccine regime, a heterologous 2-dose regime, produced immune response for up to 12 months following vaccination and was safe in pediatric cohorts consisting of young children and adolescents. And the second one is, as microbiome research has moved from associate to mechanistic studies, the activities of specific microbiomes and their products have been investigated in the development of inflammatory bowel diseases, cancer, metabolic syndrome, and neuropsychiatric disorders. Findings from microbiome research have already been applied to the clinic, such as in fecal microbiota transplantation for treatment of recurrent Clostridium difficile infection. The second one is enteropathy and small intestinal ulcers are common adverse effects of non-steroid anti-inflammatory drugs such as acetylsalicylic acid. Safe cytoprotective strategies are needed to reduce this risk. Specific Bifidobacterium breve BI195 protects against small intestinal damage caused by acetylsalicylic acid. The fourth and the last one is environmental risk factors for inflammatory bowel disease are researching, and the literature identified 9 factors that increase risk of inflammatory bowel disease. First one is smoking. Smoking is increasing chronic disease, Crohn's disease. And the second one is urban living. It's increasing Crohn's disease. Appendectomy and tonsillectomy, both of them increase Crohn's disease. Antibiotic exposure, oral contraceptive use, consumption of soft drinks increase ulcerative colitis. Vitamin D deficiency is another factor increasing ulcerative colitis, and non-HPA like enteropathic HPA species increased inflammatory bowel disease. Same literature identified 7 factors that reduce the risk of inflammatory bowel disease. These are physical activity, breastfeeding, bed sharing, tea consumption, high levels of folate, high levels of vitamin D, and Helicobacter pylori infection.
Now it is the advertisement time. Hello again. Two programs before we started to talk about the magician healthy foods. Now we are continuing to talk about these foods. Dr. Kayhan, what is the foods?
About green apple, first
Green
of all.
apple?
Yes.
Okay.
This is all invaded all the world, and it's interesting fruit. Apple is a very nutritious fruit containing a lot of vitamins and minerals with several impressive health benefits which qualifies it as a part of one's daily diet. It's packed with vitamins, minerals, and fiber that help to regulate normal blood glucose, fight digestive problems of different types and promote appetite. These are just but a few to mention. Among other benefits this fruit adds to human health. Listed below are the comprehensive benefits of apple on human health discussed in this section. First one is improves cardiovascular health. Apple has the content of soluble fiber, which has the characteristics of lowering high level of bad cholesterol in the blood caused by high fat foods and improving general cardiovascular health. Results from scientific studies showed that eating an apple on daily basis helps to reduce arterial plaque, lower low-density lipoprotein, balance sugar level, and thwart other illnesses associated with the heart. Generally, the presence of high potassium content and epicatechin, an oxidant flavonoid, helps to improve heart health. The second one enhances metabolism of the body. Apple contains soluble fiber, which makes it a strong antioxidizing agent that enhances the metabolism of the body. It is good to eat apple regularly because it's a natural metabolism booster, but more effective in the morning as it will fasten the speed during morning hours. The presence of iron in green apple fruit also helps in the process of metabolism and quick absorption of oxygen in the body. Boron is a trace of mineral in an apple that also helps the body to metabolize appropriately and make use of other vital nutrients. The third one helps to detoxify the liver. Green apple fruit helps to detoxify the liver by removing some harmful toxins. It contains active detoxification properties which make it very effective for cleansing the liver. Drinking the apple cider vinegar with water daily is a natural remedy that contributes greatly, just as apple fruit does, to protect liver problems by eliminating harmful toxins from the liver. The fourth one reduces digestive problems. Eating of green apples can help to reduce digestive tract diseases. Apple fruits are rich in fiber, which helps to maintain a healthy gut. The fifth reduces blood cholesterol. Scientific studies carried out to compare a cholesterol moderating drug, statin, and an apple showed that apple is more effective in reducing bad cholesterol, which causes serious heart problems. Sixth one, enhance of low appetite. Apple contains organic acids that help to control human appetite. Therefore, people who suffer from low appetite can use the green apple fruits to boost their appetite. The seventh one reduces the risk of asthma attack. Apple fruit contains an important flavonoid compound on the skin known as quercetin, which helps to reduce the tendency of an asthma attack in the human body. The eighth one prevents allergies. Other important compounds in apple fruit are quercetin, catechin, and cholinergic acid, which are all flavonoids with potent antioxidant actions such as fighting sickness, like certain allergies, also helps in body pain reduction. The ninth one lowers the risk of diabetes. Apple fruit helps to prevent the risk of type 2 diabetes, which is caused by beta cells insulin damage due to response of a soluble fiber that stops the blood sugar spike. The 10th contains properties that help to prevent cancer. Studies supported the American Association of Cancer Research proved that flavonoid and triterpenoids compounds in apple play a key role in frustrating the growth of pancreatic cancer and other tumors in the human body. The 11th maintains proper bone health. Apple is one of the major fruits considered the powerhouse for bone health due to the presence of vitamin C, potassium, fiber, and calcium, which are bone nutrition density. The 12th helps in boosting brain health. Antioxidants play numerous roles in overall human health, which one of them is boosting the brain health. Apple is rich in antioxidants, and these properties make it very good for brain health. Juice contained in an apple fruit helps to lessen mental decline as well as protects a neurotransmitter in the human brain called acetylcholine, which tends to have age-related function reduction. Vitamin C is one of the major properties in green apple fruit, which is an essential dietary nutrition that performs many vital functions in the body system. Eating one apple per day is a daily recommendation by nutritionists and health practitioners because it helps to flush out toxins in the body and other numerous benefits it provides. When should I eat an apple a day? Apples takes about 40 minutes to digest properly. Because of this, people that have digestive problems or late dinner habit shouldn't eat it before bed. Instead, take it in the morning after waking from sleep. Green apples. English apple has different varieties such as the green apples, red sweet apples, yellow, and pink. These colors on apple pigments are just the natural colorings that develop as apples grows. The taste of all these varieties of apple remains the same, just as the benefit they offer to man's health and lifestyle in spite of the colors. Apple is one of the most consumed fruit in the world today, cultivated in most parts of the world. Green apples, which originated in Australia, are today grown in most parts of the world, including West African countries, predominantly in just Nigeria. Apple is a diet-rich food containing several nutrients such as minerals, vitamins, and many plant compounds such as folate, potassium, phosphorus, calcium, copper, iron, magnesium, manganese, selenium, sodium, zinc, vitamins A, B1, B2, B6, C, and folate. The other amazing health benefits of tropical almond, reduces cholesterol. Both of the fruits and seed of tropical almond fruit contain calcium and have a great effect in reducing the level of cholesterol in the body, especially low-density lipoprotein cholesterol levels. The second one, tropical almond reduces inflammation. The seed of tropical almond fruit has an oil content that tends to reduce inflammation in the abdominal cavity. Almonds contain two very essential fatty acids, which include linoleic and linolenic acids. These two fatty acids help in the lowering inflammation all around the body. The third one of tropical almond promotes healthy bone. Tropical almonds, nuts, are a rich source of dietary phosphorus, vitamins, minerals. Phosphorus play an important role in the bone formation and repair of the cells of the body. The fourth one is improves immune system. Research has shown that the tropical almond fruit contains zinc and manganese, which helps in the proper functioning of the immune system and metabolism of fat and carbohydrates, among others. The fifth one is rich in fiber. Tropical almond fruits are rich in fiber contents that prevent the body from certain illnesses. High intake of fiber helps in reducing the risk of developing various conditions like diabetes, heart diseases, constipations, and others. Sixth one helps in pregnancy. Presence of folic acid in the fruit helps iron present in the almond work properly in the body and reduces the birth defects in the newborn, which is an incidence that can be dangerous to babies. Intake of this almond is food for pregnant women due to its richness in folic acids. The seventh helps in weight loss. The monounsaturated fat that is present in almond aids in satisfying the appetite and reduces much eating. The dietary fiber found in almond aids in keeping you full for a long time. Also, the fiber contained in it helps in consistent bowel movement, which contributes to weight loss. The eighth promotes brain health. Almonds are a rich source of many nutrients that contribute to the proper development of human brain. It's considered to be an essential food for growing children. Studies have proved that almonds in the diet and as oil is beneficial to the overall health and proper functioning of nervous system. The ninth one is improves the skin. Almonds are also beneficial to our skin health. Almond oil massages are normally recommended for newborn babies. It helps treating skin diseases like dermatitis, redness, other skin diseases. The 10th one is it prevents constipation. Almonds are rich in fiber, which contributes a lot in preventing constipation. While consuming almonds, it's essential to drink water that will help to speed up the digestive process and the beneficial effect. The 11th regulates blood pressure. The presence of potassium in almonds helps in blood pressure regulation and control of blood pressure fluctuation. Other numerous nutrition contained in it also helps in preventing many deficiencies. 12th regulates blood sugar levels. Almonds aids in lowering the conservative rise in insulin and glucose levels after meals. The third one promotes a healthy heart. The presence of the monounsaturated fats, potassium and protein in almonds are beneficial for the health of the heart. It prevents also cancer. Regular consumption of almonds aids in enhancing the movement of food through the colon, thereby preventing an increase in colon cancer and its occurrence. It's rich in antioxidants. Almonds are known to be a great source of alkali materials that benefit the strength of immune system and the ability to prevent various health problems. Almonds are also rich in vitamin E, which is an effective and powerful antioxidant. It fights against all the harmful free radicals in the body and removes them before it leads to chronic diseases, can be very dangerous to the body. What are almonds good for? Almonds have numerous health benefits, which include the ability to protect the health of heart because of the high content of monounsaturated fats. Almonds help in strengthening the bones, protecting the skin, helps in controlling the blood sugar levels, helps in digestion, and helps in boosting circulation. They also aid increasing the performance of cognitive and also lowering the oxidation stress in the body. The roots, leaves, seeds, and fruits of African almond are generally useful to our health as they can be used in blood glucose regulating abilities in the pancreas of one suffering for diabetics. It's also used preventing an increase of lung cancer and sickle cell anemia, and also used in lightening ejaculation. The leaf contains an effective substance of chemoprevention of cancer and has anti-carcinogenic properties. Conclusion: tropical almonds are healthy fruits containing many phytochemical compounds with quality nutritional values. An almond is botanically known as Terminalia catappa. There is no doubt about almond benefits to our health, but taken moderately is very essential.
Okay, Dr. Kayhan. We are going to explain the magician healthy foods in the next episode. This is the end of our program, and we are going to see you the next episode. Okay, bye-bye.